Hi, I'm Meshal Malik, and you're watching Indus Special. According to a report released by the World Health Organization earlier this week, prevention and treatment services for non-communicable diseases have been severely disrupted since the COVID-19 pandemic began. In the report, the World Health Organization surveyed 155 countries during a 3-week period in May, confirming that this disruption in services is global. Let's discuss this further. Joining us for this conversation is Alaana, Shaikh, who is a global health consultant and focuses on health systems and the response shocks. She joins us from Colombo. Also joining us today is Dr. Sokomba Aliyu, who is the president of Nigerian Association of Resident Doctors. He joins us from Lagos. Thank you both for joining us and welcome to this show. Ms. Alaana, Shaikh, let me begin with you. And before we talk about how much disruption there is actually in terms of treatment and services for non-communicable diseases, could you take us through the global burden of these diseases to begin with? How much of the health sector's facilities and resources are needed to treat these? And what is the global death toll due to non-communicable diseases?
So non-communicable diseases are a huge part of the global strain on health systems for a variety of reasons. One reason is that by their nature, they require consistent healthcare system access. If you have diabetes, if you have a heart condition, then you need repeated access to the healthcare system in order to manage your condition. Depending on the country, non-communicable diseases make up different proportions of the death toll. In countries that are higher income, non-communicable diseases make up the bulk of deaths and of health system resources. And in lower income countries, it's not that non-communicable diseases happen less, it's that there's also more diseases that are acute. And so there's a greater burden on those health systems. So globally, non-communicable diseases are a huge part of what affects human health.
Right. So, Ms. Alaana, Shaikh, when we talk about the fact that these diseases require consistent treatment, consistent visits and consultations with healthcare officials, medication that needs to be given and taken regularly, how and in what ways has COVID-19 impacted all these various things that go into a person being able to cope with non-communicable diseases?
So there have been sort of three major forms of impact. One of which is people having access to the medications that they need. If they can't leave the house, if supply chains are disrupted in their community or their country, they may not be able to get their insulin, they may not be able to get their blood pressure medicine. So there's a disruption in the supplies that they need in order to protect their health.
Right.
And then there's a disruption in their ability to actually go to the doctor, to see a health worker, to see a nurse. If there are curfews that mean they can't leave the house, or if health facilities are turning away people who are not emergencies because they're worried about transmitting COVID-19. And then finally, a lot of the management of a chronic disease is personal and depends on the individual's willingness to take good care of their health. And there's a real mental health impact to COVID-19, and that may impair people's ability to take good care of their own health.
Right. Dr. Sokomba Aliyu, talking about that same point here, and especially in where you're talking to us from right now, how do you see the real-time implications of this? Ms. Alaana, Shaikh has given us a very comprehensive general overview, but I want to contextualize what's happening to specific locations. How is this happening in Nigeria at this point in time? What are some of the things you're seeing in health facilities around you that were in normal cases dealing with non-communicable diseases and those patients who were,
In countries like ours, Nigeria, that is a low and middle income earning country, in addition to the burden of non-communicable diseases, we are contending with communicable diseases as well. So it's true that the COVID-19 outbreak has impacted negatively in the care of non-communicable disease worldwide. In addition, in specific countries like Nigeria, we are also contending with the impact on communicable diseases. As she has rightly stated, because of the COVID-19, one of the measures that countries have employed to contain this disease is lockdown, the curfew. And the curfew is largely restricting the access of people with communicable diseases as well as non-communicable diseases in getting care. Secondly, because of the weak health system countries like Nigeria is contending with, the burden of communicable diseases, non-communicable disease, and now COVID-19 is burdening the healthcare workers in the country. And as such, for the health system to contend with COVID-19, they have to suspend care for the non-communicable as well as communicable care in order to attend to COVID-19 and provide the necessary care that is required. So basically, in addition to the non-communicable disease we are dealing with globally, we in developing countries are as well dealing with the impact of COVID-19 on communicable disease. And largely, it's causing a very significant problem, and mortality is arising as a result of the suspension of care to communicable as well as non-communicable in this part of the world.
Right. Dr. Aliyu, now this conversation about that those who have underlying health conditions already, mainly diabetes and especially non-communicable diseases, they are at a higher risk of developing or contracting a more serious case of coronavirus. But also these individuals have to be more protected. Now we know that someone with an underlying healthcare condition will need regular checkups. They need to contact their doctor. Are there innovative ways that doctors are dealing with this problem, trying to find solutions? Because we know that this pandemic and this wave of coronavirus won't be ending anytime soon.
We have been advocating that we can introduce the online care service for all those who will be requiring healthcare services beyond the hospital walls. So we have been advocating that we should introduce the telemedicine. That way, people who need care can stay at home and access care from professionals, and that way their continuous care will be guaranteed. Secondly, we are also advocating that in countries like Nigeria and other low-resource income countries, they should increase the supply of funds to the health system so that the health system can be strengthened further and more manpower can be made available to attend to both COVID-19 and as well as the communicable and non-communicable diseases that are prevalent in that society. And third, we are also advocating that in addition to the telemedicine, people who need care should be allowed, even while lockdown persists, should be allowed to access care as long as their care, the need for the care is genuine, and those group of people should be given the exemption to access care even as lockdown persists in countries that are implementing lockdown. So these are some of the ways we are advocating, and we are hoping that if they are implemented, the access to care for communicable and non-communicable can be sustained.
Right. Ms. Alaana, Shaikh, you makes that important point there that there is a need to address the fact those who are dealing with serious cases, they need to seek help for their medical conditions, even given that we have this pandemic ongoing. The World Health Organization, in its earlier guidelines, itself stated that it's better to put off checkups and any routine visits to hospitals because of the scare of and risk of spread of the infection. Now, given that both these things are going side by side, how can countries prepare their health infrastructures for dealing with those who have underlying diseases and who need those regular checkups?
So as Dr. Aliyu mentioned, one approach to that is telemedicine. And with a lot of chronic illnesses, the checkups that you need can be done remotely. You don't necessarily need to be in person at the doctor's office. That's one approach. Another approach is now that we have a better sense of infection control for COVID-19 and a clearer sense of how it spreads, it's safer to be going back to healthcare facilities. So we can start, encouraging people to come back. I know the United States saw a big drop in people even for emergency room admissions. Like one of the questions is what happened to everybody with appendicitis because they weren't coming into the emergency room. And so people need to feel comfortable going back again in emergency cases and for important chronic care.
Right. You mentioned here that since we have a better sense of cope with the coronavirus, there needs to be a movement towards helping those who have those other chronic diseases. But do we, in fact, have a better sense of how to deal with this? Because we're seeing health infrastructure across the world collapse at this moment. It still seems like many things are out of control and are spiraling out of control.
We have a better sense of one very specific thing. We have a better sense of how to keep it from spreading in healthcare facilities. Like the WHO has guidelines on sanitizing surfaces, on how to make sure that exam rooms don't spread the disease. So one thing we have learned is how to make healthcare facilities safe from disease spread. So that's sort of one very specific thing we've learned. I agree completely that caseload is still overwhelming in many locations, and COVID-19 is still spreading in so many communities unchecked.
Right. Dr. Sokomba, Aliyu, how is this working on the ground, keeping with those protocols of sanitizing your healthcare centers, of making sure that there isn't widespread infection rates within doctors and nurses who are working there? How's that working in Lagos, where you're talking to us from, in Nigeria overall?
Well, basically, the country is contending with the disease. Recently, several measures have been put in place to provide necessary personal protective equipment to all healthcare workers while attending to patients that are suspected to be COVID-19. And that way, we are able to contain the spread of disease among healthcare workers. Secondly, there has been an intensified testing for people that are suspected. And beyond that, even community testing has commenced. And we are at the moment able to detect a large number of people who have the disease and isolate them in good time. So by and large, we're able to have the disease spread among healthcare workers in control. So we are basically we are having a good control of the situation at the moment.
How is the government there making sure that, as you said before, it's important to have those running funds, that funds aren't drying out in this case? Because belonging to Pakistan and belonging to this part of the world, we know that many South Asian countries that are in the developing phases, they are having that struggle on how to dedicate more resources to the health infrastructure when there's so much else that is going on.
Well, at the moment, that has continued to remain a challenge in Nigeria. The budgetary allocation to health has continued to remain far less than what is recommended by the World Health Organization of 15% budgetary allocation to health. And we are hoping that the government will see the need to allocate more resources to health. That way, we'll be able to attend to emergencies, communicable disease, as well as non-communicable diseases. At the moment, we are still battling with inadequate funding of the health sector, and we are optimistic that if the government considers this a priority, more funds will be made available to the health sector to address this.
Right. Ms. Alaana, Shaikh, talking about funds specifically, we have heard and we know now that the United States has halted its funding for the World Health Organization. And a lot of speculation and a lot of analysis says that the backlash of this will be on developing nations, those with weak health infrastructures. But talking about the overall state of affairs when it comes to how global funding is being dedicated to healthcare sectors, do you see it being enough? And how do you think we can bring about actual increases in it, given the struggles, economic struggles that all countries are facing at this point in time?
So if you look at the recent WHO appeals for funding, not just for COVID-19, but for several other global health issues, they're all falling short. The World Health Organization and global health in general are not getting the funding that they need in order to grapple with the situations we're facing. And that is an enormous challenge. And when you look at health, the money that you put into healthcare and to healthcare services is genuinely an investment. It really reduces your costs further down the line. So I think if people understand that it's an investment, that you put this money in and you get vastly more benefits than you invested. And then secondly, if the higher income countries, even in the face of economic challenges, realize that we are all in this together and that we are only as safe and healthy as the poorest country in the world, that they'll be more willing to contribute to global efforts to fight different kinds of disease.
Right, Ms. Alaana, Shaikh, just last question to you. Now, we see this discussion being, this becoming a binary discussion. Either it is the economy we're talking about or trying to handle this pandemic. And for that, of course, we know for the economy, there's other investments need to be made. How do we make this discussion more nuanced? Health professionals like you, health experts like you, how can those voices come and convince policymakers to have a more nuanced discussion about this? As you said, it's a long-time investment, one that we'll see having costs fall in the future. But it seems like there isn't recognition of that at this point in time.
It's a false dichotomy. I mean, health and the economy are partners. When the economy is stronger, people are healthier. When people are sick, they weaken the economy. The two things affect each other, and you can't pretend that they oppose each other when, in fact, they go together. And it's easy to say that we should let COVID-19 spread because we care about the economy. But the fact is, if people are getting sick and COVID-19 is spreading all over the place, that's going to affect the economy too. People getting sick, people dying has a pretty large negative economic impact. And I think that's getting lost in this discussion. So I think it's false to put them together like they oppose each other. We have to think of them as partners, health and the economy.
Right. Thank you so much for those comments, Ms. Alaana. Thank you for taking out the time and joining us. Dr. Sokomba, Aliyu for joining us. We're going to go for a short break. When we come back, we talk to health experts on how women due to give birth and mothers with newly borns can cope with the times of COVID-19. Stay with us. Welcome back. The anxiety and uncertainty surrounding the pandemic is difficult for all of us, but is especially causing greater stress for pregnant women and new moms. With the risks, there is a need to now be more safe than ever before. On the show today, we discuss what women who are expecting and have recently given birth need to keep in mind and what protocols should be adopted to lend healthcare services to them. Joining us today for this discussion is Niloofar Ganjian, who is an epidemiologist from the Milken Institute of Public Health at the George Washington University. She joins us from Washington, D.C. Also joining us today is Dr. Jack Zinger, who's a consultant pediatrician, and he's also an honorary senior lecturer in child health at Imperial College. He joins us from London. Thank you both for joining us, and welcome to the show. Ms. Ganjian, I'd like to begin with you. Now, starting from the very basics, we know that healthcare around the world is being impacted in unprecedented ways, but how exactly is maternal care being impacted with what's happening?
Sure. Of course, you know that during public health emergencies, it is quite common to see that human and financial resources from health programs are diverted to respond to outbreaks. I think in this case, we must be very certain that during the pandemic, maternal and newborn health be prioritized. One thing that is quite important is that women have access to safe birth, and we can ensure that the continuum of care and postnatal care with screening tests according to national guidelines and standards are especially taking place.
Right. I don't want to take this term you mentioned here, safe births, for granted and assume that everyone who's watching exactly knows what it implies. So I'd like you to explain to us, especially during this time, what that means.
Yes, I think that really does imply that there is the ability for a woman to receive the type of care and treatment necessary in order to ensure that she's able to give birth in a safe circumstance, if that helps answer the question.
Right. And just about how that's being made difficult is, of course, the fact that there is a danger in many healthcare facilities that there is a rising rate of infection amongst doctors, nurses, midwives. Given that, what do women do? Because that's the main panic surrounding if their delivery is due soon. Should they even go to the hospital? This is one of the most frequently asked questions on social media, on various sites. That's a major concern. What do you think is the consensus on that?
Yes, so there's no current evidence of the adverse effects on pregnant women from COVID. With that said, it's important that infection control measures be taken into consideration at hospitals. And I believe that this is occurring in many places around the world. These decisions should obviously be made in accordance with with government, but it involves triage flow and segregation of neonatal and maternal health, as well as antenatal, neonatal, and maternal health units segregated from confirmed and suspected cases of COVID.
Right. Dr. Jack Singer, now when we talk about the support that healthcare professionals are giving to individuals, and especially in this case, young parents and their children, such as yourself, how is that dynamic changing, and what are some of the ways, innovative ways, in which you're trying to help parents during this time?
Some of the ways, actually, a lot of this is continuing on with what would you do in a normal situation, actually. And in some respects, it's quite helpful because it highlights good hygiene, good hand washing, preventive measures that one would take to prevent infections between the mother and the rest of the family, and so on. So in a way, it just accentuates what would be a normal situation in terms of maternal and child care. What we do here is we stagger our appointments so that there's no overlap between families, so they don't have to sit with each other in the waiting room. Another thing is that we've used extensively video conferencing and phone consultations. I would have thought 6 months ago that in carrying out pediatrics that I would have said that this is impossible, that you have to have a face-to-face consultation and examine the child. But it turns out this is really not the case. And in talking to colleagues, we reckon that about 60% of pediatrics can be done on the phone or with a video consultation follow-up, because frankly, the cameras on the iPhones or on iPads and so on are much better than your eye in terms of dermatology, malformations, and things like that.
Right. Dr. Singer, I don't want to deviate from our conversation here, but I think it's important to talk about how this will impact the future of medicine and healthcare provision. Do you see this as a permanent change, as you're saying that almost 60% of healthcare provided to children and talking to parents can be done over phones and telecommunication? Do you think that this would be a permanent change later on?
I think it is. In discussions with my colleagues, we've said that if you tried to introduce this as a pilot project and so on and so forth in the usual way, it wouldn't have gotten anywhere, frankly. But the mother necessity is what we're seeing here, and because it's done in a rapid way, that actually people now, if we ask, would you like to see the pediatrician with your child, they say, no, we'd rather have a phone consultation. Due to the fact that a lot of times they're quite frightened to come into the hospital, although you did touch on that, into the A&E. For whatever reason, I think what we're going to see now is it's going to be changing, and medicine has to accept the fact, not only in pediatrics, but in the other disciplines, that this is how things are going to be organized, and it's going to be much more efficient. Because if you can reduce the individuals in the outpatient departments by 50%, say, that frees up, more time between consultations and allows you to expand the services that you would not normally have room to expand to.
Dr. Singer, at what point would you say that, or what situation or set of situations do you think it is absolutely essential for parents to bring their children in? As you say that for regular consultations, it is pretty easy to do it over the phone, but many parents wonder what is a normal situation and when should they, in fact, go into the clinic or go in to see their doctor in person?
It all depends on the reason, obviously. One of the things that initially when there was a massive lockdown across the world, one of our big concerns in pediatrics was the falling behind of children with normal immunization schedules.
Right.
People forget people get sick from other viral or infectious diseases, which are covered by immunizations, and it's really important not to let that happen. Again, I think it depends on the specialty. If it's general pediatrics, most people, depending, will tell you what, and you can, when you speak to them, whether they really want to see a pediatrician face to face or not.
Right.
Obviously, certain specialties you really do need to have a face-to-face consultation, especially the surgical specialties, ENT and things like that. But in general pediatrics, bar the high fevers, which we're not seeing simply because children are on extended holidays due to the lockdown, a lot of this can be covered in a phone or video consultation. I mean, dermatology, congenital malformations, the general pediatric advice on feeding and so on. This can all be done over the phone or on a video consultation. And if necessary, a follow-up consultation on a face-to-face basis with the pediatrician.
Right. Ganjian, on that point of talking about what can be done at home and what shouldn't be done, of course, we heard Dr. Singer talk about the fact that we're not seeing such a high pattern of high fever and those symptoms of COVID-19 amongst children. What more do we know about this demographic? A lot of parents are still in the dark when it comes to how vulnerable their children are to contracting the coronavirus.
Yes, well, there currently is no widespread current evidence of adverse effects on babies and infants from COVID. However, I really can't stress enough the importance of really limiting COVID transmission and the importance of community level education and basic sanitation and hygiene and making sure that people are washing their hands and keeping their distance during this time.
Right. Another point that I bring up is more specific to the South Asian context, which has to do with how households are set up. Here, many families, at least two nuclear families live in the same house, often grandparents with young kids. And this argument that children might not have a serious case of coronavirus, but they might be carriers. What type of community education do you think needs to happen in this regard?
Yes, again, I think that the sanitation can be quite helpful, hand washing, as well as just ensuring that people are paying attention to potential onset of symptoms and being very cognizant and aware of whether they're beginning to feel ill and so that they can begin to isolate themselves from the rest of their families.
Right. Dr. Jacker, just one last question to you before we let you off there. How many cases have you witnessed of children perhaps having the coronavirus and definite cases in this case?
Well, that's a difficult question. I mean, it's a simple and a difficult question to answer at the same time. The children, as my colleague said, basically the studies that we've done at Imperial and a very large study that's just been published by the Royal College of Pediatrics here in London, so they mentioned that 50% of children that they looked at were asymptomatic or had mild symptoms. The other studies show that roughly 30% of children have no symptoms but are shedding virus, which is the real issue. And in terms of my own experience, I've had one child with a COVID-19 positive encephalitis, and two who've been in the pediatric intensive care unit at Great Ormond Street with the new it's called Kawasaki-like, but the eponym we use now is PIMS, which is a multi-organ inflammatory disease response to the COVID-19. And the age range is from, there have been over 100 cases now, and we've seen personally two, between 3 months and 18 years. The things that make these children difficult is that each one is totally different because it's a new syndrome, and we're learning all the time. But even using the PCR swab tests, a number of these children will swab negative, say, for 2, 3, 4 times, and then become positive. So it's very difficult syndrome to diagnose. And the other one, which we haven't answered yet, is the children, if the majority of children who are asymptomatic but are shedding virus, do these children have COVID-19 antibodies? And if so, how long is their protection?
Right. Thank you so much, Dr. Jack Singer, for joining and answering our questions, giving us that very important information. We're looking forward to talking to you again on this topic. Ms. Niloofar Ganjian, talking about this, that it almost dispels this myth that existed while talking to Dr. Jack Singer, that children cannot be impacted by the coronavirus and they have some sort of immunity to it. It does exist there. There are cases. Given that, how do you think countries need to move towards removing or at least reducing their stringent lockdowns, keeping this piece of information in mind that children are not immune to carrying the coronavirus?
You know, I would certainly recommend that countries do assess their guidelines and do take a look at WHO guidelines as well as different types of recommendations that are out there when determining how to go about approaching the end of lockdown.
Right. And in many countries, the debate regarding whether to open schools or not is now coming into the public realm. What do you think is the main guideline on a case like that?
You know, unfortunately, at this moment, I would have to go back and check in on that. However, here in the States, I believe that schools have been out until the end of the year, and it'll be interesting to see what will happen in the fall as courses resume again. It is unfortunately a day-by-day, case-by-case basis, and it is up to individual countries to determine what is best for their population.
Right. On that point, I'd also like to introduce Dr. Misbah Malik, who's a consultant gynecologist joining us from Lahore. Thank you so much, Dr. Malik, for joining us, and welcome to the show. We've been talking about how maternal care has been impacted across the world, but how is it specifically the situation unfolding within Pakistan? What can you tell us more about that?
First of all, thank you very much for giving this opportunity to talk on this very important topic, that is today's pandemic, COVID-19. As we know that pregnancy is a severely immunocompromised condition. This is from nature, so that the mother accepts the fetus for 9 months. But on the other hand, this immunocompromised situation makes the woman prone to all viruses and bacteria. That's why the pregnant woman is very much prone to the COVID-19 as well. So the basic thing to do is to try to avoid and prevent this disease. The basics is to be understood by all the patients that the virus particles is heavier than air and it tries to settle down on all the surfaces. Whatever surfaces comes in this way, the virus tries to settle on that. On your books, on your table, on your mobile, on currency notes, keys, etc. So whenever you are going to touch those things, the virus is going to transmit from that surface to another surface, which is our hands. Right. Still, we are not infected. But when we are going to touch from these hands to our nose, mouth, eyes, then we are prone to the infection. That's why we are advised, all are advised to wash hands properly for 20 seconds, soap and water, to use sanitizer, to use gloves while working. This is the basics behind it.
Dr. Misbah Malik, it seems like the basic advice that is given to the general population is also, of course, one that applies to pregnant women and those who have recently given birth. But talking more specifically about the care that is required during this time, especially prenatal care and postnatal care, what are some of the recommendations gynecologists as yourself are giving to women who in other normal circumstances would come to the hospital, come to the clinic for regular visits?
As far as special protocols are concerned, the women they're supposed to be in contact with the gynecologist on phone as much as possible. They don't have to run to clinic for small things. Even if they assume that they are probably having corona positive, there is no rush to the clinics to avoid exposure to other patients. Try to be in touch with your gynae. Try to boost up your immunity by using prenatal vitamins, calcium and iron, and have good nutrients in your food so that to boost your immunity. And as long as other questions are concerned, stay at your home, try to avoid crowds, and whenever you have to go to the hospital, please use special measures. And whenever you have to wait in the waiting area, try not to sit on the waiting chairs, try to stand and try to stay away from the other crowd. Go to the hospital
Right, Dr. Misbah Malik, since I'm short on time, I just want to get to this point and talk about what protocols maternity wards are taking in this situation. Those places, and as we know, we're seeing more and more healthcare workers being infected with COVID-19. And so there is a risk just being in that area, being in a medical facility itself. But as you mentioned, pregnant women are severely immunocompromised in their condition. What is being done in the maternity wards? What protocols are being taken?
First of all, the COVID-19 people, whether they are doctors or paramedical staff or any other staff, they should not be allowed there. They should self-isolate themselves and be quarantined. No hospital is going to allow COVID-positive 19 in any department, including the maternity department especially. So there is no permission for any COVID-19 staff in the maternity case. Secondly, strong PPE measures. It's supposed to be taken by the doctor himself or herself and all the staffs, and all the measures are being taken strictly in the maternity department and during delivery and even after the delivery, because no researches are even there that COVID can be transmitted to the baby in uterus, during delivery, and after delivery. So all measures should be taken very strictly by the staff and being taken. Yes.
And just one question before I close off here the discussion, we end the discussion here. Dr. Misbah Malik, what about family members? We know that during this time a woman needs support, but given the situation, what are the recommendations for family members accompanying the woman who is due to give birth?
Yes, you have asked a very important question. That is nowadays problem. Whenever pregnant patient comes for delivery, there is a tendency that the whole family comes with the patient, and their purpose is to morally support the patient. But nowadays, my recommendation is to bring as less members as possible. You have to bring moral support is equally, moral and emotional support is equally important for a patient who is about to deliver, but not the whole family. Your spouse is the most important one, and another aunt or any other, your sister. Please don't bring other patients to, don't expose them to COVID-19, and as less people as possible. Yes.
Right. On that point, thank you so much, Dr. Misbah Malik, for joining us. Thank you, Ms. Niloofar Ganjian, for joining us from Washington, D.C. Thank you for watching Indus Special. We will see you again next week with more stories. Till then, goodbye and take care.